Yeah.
So a warning today from local healthcare providers about knowing your numbers.
Joining us now to explain why is medical reporter Liz Bonus. Liz.
Hey guys, good afternoon to you once again. This team here at Fifth Third in Madisonville teaming up with the American Heart Association and Mercy Health this year to learn more about knowing your numbers. What they've learned might help all of us, and here's why.
Blood pressure is the silent killer. Over 50% of Americans have hypertension, and half of those individuals don't even know that they have it.
The reason you need to have these numbers tested, such as blood pressure, is that you can't feel that they're high.
A lot of the things that we're screening for, a lot of disease states, really don't cause any symptoms until years down the line when they end up resulting in a heart problem or a stroke or something like that. So the idea really is to catch these contributing factors before they cause their damage. So the only way to do that, if you're not having any symptoms, is to have a regular visit with your physician.
It's one of the reasons Amy Hussey recently had her blood pressure checked.
I'm getting older, and I thought I really need to start paying attention to what's going on.
Blood pressure, cholesterol, weight, and other inflammation markers cannot be felt in the body. They have to be measured. The good news is that simple changes to diet and exercise can often bring them down if you catch them before they damage your body. And the good news for Amy?
So I wasn't horrible, but I wasn't where I should be.
Which, by the way, when it comes to blood pressure now, is lower than it used to be.
120/80.
So it used to be like 140/90, and they shifted those, and a lot of people don't even know now that they're in the risky range. And there's two things to know about that. One is when you bring it down like 5 points, the number of strokes that dropped was so significant you wouldn't believe it, that little bit. And second, that there's this idea that I'm going to feel like there's something wrong in my body. And so you're thinking I'm fine, and then you have a heart attack, they can jumpstart your heart. You have a stroke, you often live disabled. And so knowing that like something like blood pressure or cholesterol, numbers like that you can just drop a little bit, make a big difference, can change the rest of your life.
You know, what's really weird is when you do go every year, because I've always gone every year since my 20s, and when you first see the first little sign of something, it's very weird.
Yes.
You know, I mean, just a couple points when
you
you're like
fine.
exactly the same, and then you just get a 2-point change even, you go, huh. You know, you really don't always know.
You feel fine. Yeah, good for you. But good for you for staying on it. We're going to be in, Kyle, good health habits are infectious. So
I was going to say I need to do better at knowing my numbers.
He's doing a